So starting most superficially in the glute area, we have our gluteus maximus muscle here. If you reflect that, you can see your gluteus medius muscle. That's all of this right here. If you reflect that deep in here, that's your gluteus minimus muscle. So note this is bone here, and the minimus is inserting on the bone. So that's kind of the giveaway for that. This right here is going to be your artery, nerve, and vein, the superior gluteal. So I took off the veins on the tag structure list to make it easier, so then you only have to tell the difference between the artery and the nerve. So it looks like this right here would be the nerve, and this looks like vein to me. So does this. So I'm thinking the artery probably got cut, which means if it's tagged, it'll be tagged on the other body. And then here, these are your inferior gluteal, artery, nerve, and vein. So these, remember, we had to cut so that we could reflect the gluteus maximus. So these are not the best tag. And remember, your piriformis muscle is your key reference structure for this area. So this right here is your piriformis muscle. And this is a great reference structure because your superior and inferior gluteal artery, nerves, and veins are named by where they are in relation to this muscle. So these are superior and these are inferior to the piriformis, which is why they're called that. Also, your sciatic nerve comes out just inferior and deep to your piriformis. So if you move your sciatic nerve out of the way, you can see the remainder of your lateral rotator muscles. So this is not the best dissection. I believe our other body has a better one, but just count your way down. So remember the Pagogo Q. So you have P, G, so gemellus superior, O. So this here is going to be your obturator internus. Then you're going to have your gemellus inferior, and then your obturator externus is the one that's kind of more on the anterior side, so you can't really see it from the back. I'm not going to tag that. And then the Q is this one right here, the largest one, your quadratus femoris. These are all the lateral rotators of the thigh. So remember, if I ask you a question about them on the lecture exam, to include the obturator externus in those, even though it's not going to be tagged. So moving down, so you can follow your sciatic nerve into the posterior thigh to find the split. So your sciatic nerve is going to split into the common fibular nerve, which is this one right here, and the tibial nerve. So remember, your tibia, the bone, is going to be medial because it is the weight-bearing bone, versus your fibula is going to be lateral. So if you orient yourself on the leg, you know that this is lateral and this is medial, so you can figure out the names. So again, that's tibial nerve and common fibular nerve. And as we all know, if it's a common, it's going to split again. So your common fibular is then going to split into a superficial and deep fibular, which you can't see here, but we'll see in the leg. So muscles of the posterior thigh, you're going to have your hamstrings. Remember, there's 3 hamstrings. You're going to have your biceps femoris, long head, your semitendinosus right here. And to tell the difference between your semitendinosus and your semimembranosus, always look for that long tendon that's going to the Pizancerin. So you see the tendon, this has to be semitendinosus. Semimembranosus is going to be just deep or anterior to it. So remember that these are grouped into the hamstrings because they all have the same origin at the ischial tuberosity. They're all innervated by branches of the tibial nerve, and they all have the same action. So I would know that for your exam. Here, this is the last posterior thigh muscle. This is not a hamstring. This is your biceps femoris short head, and it can't be grouped as a hamstring because it has a different origin and it is innervated by fibers that will form the common fibular nerve. Artery back here, the only artery that you need to know on the posterior aspect of the leg is the deep femoral, which I don't think that we dissected out on this leg, but that's the only artery that's going to travel back here. And remember, that's coming off of the femoral, which is on the anterior aspect of the leg.